Okay, everyone, how are you all feeling? I hope you're feeling good. Now we're going to look at topic 5, which is topic 5, part 2, skeletal. Right, so what we're going to do is we're going to have a little bit of a look at these bones just to get your mind around where they are and how they are, like their relationship to each other. You probably know a lot about a lot of these bones already, so there's probably only a few that you probably need to kind of sit down and have a really careful think about. Right, so the skeleton, protection, it moves us around, right? So you can see how our bodies would look a lot different if we didn't have bones, okay? Now, the ones that you need to kind of memorize for this subject are the ones that are highlighted in orange. But the skeletal system, it actually includes not only the bones, but also cartilages, joints and ligaments. So yeah, so fun fact for the day. Today I learned that the skeletal system is made up of these 4 things, not just the bones. So it is strong. Our bones are strong. It takes a bit of effort to break them, and its protection allows us to move around. And we use it to pick things up, like we need our bones to manipulate things. Let's just move us out of the way. This picture just shows you that there are 2 parts of the skeleton. Okay, let me move us out of the way again. 2 parts of the skeleton, which is the axial skeleton, which is the main upright kind of structure, and then the bits that hang off the axial skeleton. And you can see, look, we have so many bones, hey? Lots and lots and lots of bones. All right, let's start looking at some of these bones in turn, and I will pop us around here to get out of the way. So the first kind of structure we're going to look at is the skull. And the skull is made up of the cranial and facial bones. There's so many bones in there, hey? All right? So as you can see, the cranial bones are each made up of different bones. You've got the frontal bone, occipital bone, and they're kind of stuck together. The cranial bone, the bones in the skull are joined together by these really hard, they are pretty much cemented in, okay? These joints are super duper hard to pull apart. Now, when a baby is born, tell us about baby head bones, Keaton.
That's right. When the baby's born, those suture lines haven't yet cemented, so there may be a gap, and that's why we are so delicate with our newborns until they are able to grow together, and then these plates will form together on those suture lines, and then eventually they will harden. So to start with, we have a lot of movement in the skull, and that's so that the baby can manipulate out of the birthing canal. And then it's not until they're older that these cement into place, and then it becomes like a helmet as such for the brain moving forward for their life. So it doesn't allow for much movement if there is inflammation, and so that's something that we have to be really aware of, because it's not something that will kind of move apart and come back together if there is any inflammation.
That's right. So once it's locked in, yeah, it is kind of a helmet, and it doesn't give at all. When you think about the skull, it really only has one kind of joint, and this is the one that it's the one that we use for our mandible. Yeah, but we'll look at joints later. All Okay, facial bones, okay, they are there to allow things to get into our body and things to come out of our body. And as I said before, it's connected by a joint. So here is our kind of joint. There's spots in our facial bones for all of our accessory structures to sit. So our eyes, nose, teeth, and tongue. So they all are kind of protected somewhat. And don't forget that you have your skull, and over the top of your skull sits your muscles, your facial muscles, okay? So just make sure that you know, so you've got your skin, your facial muscles, and then your skull under that. Right, let's have a look at the thoracic cage. Now, we're looking at the chest here. Can you see how the thoracic cage is made up of certain components? We're made up of the vertebrae, which is your spinal column, the ribs, sternum, which is your thigh, and then you've got your cartilages. See there? So can you see how the thoracic cage does have a bit of give? Okay, it does have a bit of give. Now, Keaton, what happens if you break a rib? I hear that you can't do anything about it.
It's not as if we can put our ribs in a cast or anything like that, Nat. So you can have it fixed internally or externally, but certainly wouldn't wrap someone in a plaster of Paris to have that set. So a broken rib is something that we do advise the patient to look after themselves and be very careful as the body does undergo those healing processes. The thoracic cage has such an important role in protection, obviously, because we've got some of our body's most vital organs within that cage. And so the thoracic cage, if you do have a broken rib or something, it does kind of put us at risk of, injuring our lungs, injuring our heart, and those other organs that are within the cage. Just a couple of things to note here that you've discussed, Nat, is the sternum. So obviously during CPR, which all of us have done as part of preparing for workplace learning, that's where we're doing our sternal compressions. So we're aiming to push down on the sternum there so that it is going to compress the heart and keep it pumping so that the blood's not clotting. And as you've said, the ribs have a bit of give, and so it allows us to compress. But if we compress in the wrong spot, that is where we can fracture the ribs and we can have real problems there where we've got punctured lungs and ribs through hearts and things like that. So it is really important to protect that thoracic cage and identify if there is anything wrong or broken in it so that we can maintain its integrity so it can continue its role of protection. Another thing is where the ribs are here. Obviously, in between those ribs are our intercostal spaces, aren't they? Hey, we can see just down here that they're spelled out for us. And soon we're going to learn how to do ECGs. And when we do ECGs, we need to position the electrodes in between those intercostal spaces, because if we put them over the top of the ribs, we won't get the correct reading. It won't be able to read through that bony structure. So when we're looking for the intercostal spaces, this is what we're talking about, the spaces in between the ribs.
So useful, so useful. And I don't know if you noticed, but have a look at this picture. Can you see how ribs 1 to 7 and 8 to 12 are kind of attached to the sternum with some cartilage? But look at these guys, these are all hanging out on their own. Yeah? And remember, when we looked at renal, this is where your kidneys sort of are. Yeah, so they only get really like a pretty kind of, not a lot of protection there. All right, the vertebral column, the spine. Can you see straight out, the spine is not supposed to be straight, okay? It's supposed to have a curve, and that's the way that our bodies are designed. It's supposed to have the right curve. So you've got different vertebrae that make up the spine. We've got 26 bones, hey? Lots and lots and lots of bone. And the whole point of the spine is to make sure, or our vertebral column, is to make sure that our spinal cord is nice and protected and it provides support for us, okay? And see these holes? That's where nerves come out of, yeah? And you've got 2 vertebrae, yeah? Okay, so sometimes people get mixed up because you've got cervical vertebrae. So you have breakfast at 7, lunch at 12, dinner at 5 with 5 drinks for every 4 people. That's my mnemonic. Anyway, you can think of your own little mnemonic to remember how many vertebrae in each particular spot. Yeah? All right. Oh, the other important thing about the vertebral column is that you have muscles that attach to it. Yeah? So if you have a muscle that is too stretched or too contracted, it can shift your vertebral column and throw your whole posture out of whack. I learned that the hard way. Okay, here we go. The vertebrae. I've got a little video for you to watch about the vertebrae, so you can do that yourself. But when you're an infant, your vertebrae are kind of not fused. Yeah. So like the skull bones, they are there, but they're floating. So when you get older, these vertebrae, they start fusing down the bottom and they make your sacrum and coccyx. Is that how you say it? Coccyx. Yeah, coccyx. Yeah, so just be mindful of that. That's that you know, an infant's bones are still kind of fusing together. Now I'll let you watch that video on your own. Oh, how long is it? Let me see if I can play it. No, it's not playing. All right, it's not playing for me. I'll let you watch it yourself. And if you have any problem, I'm definitely in there because I put it in there myself. All right, so I'll let you watch that little video because it's quite interesting because it just explains to you very, very simply what a herniated disc is. Okay, so when you look at your vertebrae, can you see how we have some cartilage in between each one? Yeah. So that little video just tells you a little bit more about that disc and what happens when you have a herniated disc. Yeah? So make sure you watch that. Oh, now it's going to play. All right.
These vertebrae are
Let's watch it. It's only 2 minutes.
a herniated
Okay, let's go.
disc is one of the most common spinal diseases that can lead to mild to severe pain in your neck or back. There are 24 vertebrae in the spine. These vertebrae are connected by several joints, which allow you to bend, twist, carry loads, and absorb shock. The main joint is a flexible cushion between 2 vertebrae called an intervertebral disc. The intervertebral disc is comprised of a soft gelatinous center surrounded by a tough outer wall. When the gelatinous core pushes out through a tear in the fibrous wall, the disc herniates, adding
Ouch.
pressure to the surrounding spinal nerves, which causes pain. A herniated disc may be caused by simple wear and tear from repeated movement over time, or disc degeneration. With age, spinal discs lose some of their water content, making it difficult to support the load from the above vertebrae. Other causes of a herniated disc may include long-standing trauma, stress fractures, congenital abnormalities. While it is possible for an intervertebral disc to herniate at any level of the spine, it most commonly occurs in the lumbar region or lower back. Symptoms include pain at the site of the injury, pain, numbness, weakness, or tingling in the arms or legs, pain that worsens when bending, twisting, and/or sitting, muscle spasms. If the herniated disc is located in the cervical spine or neck, other symptoms may include loss of bladder control, loss of coordination, a heavy feeling in the limbs, trouble balancing. If you feel you're experiencing any of these symptoms, you should see a physician for an accurate diagnosis.
Okay, I like how they do the little proviso at the end. Yeah, so just a little bit about those discs and what actually happens with them.
If a herniated disc is established at...
Why is it playing again? I don't know. All right, we had a look at the axial skeleton. What we might do now is have a look at the appendicular skeleton. I'm kind of figuring out that it doesn't matter where we are, Keaton, we're always in the way. All right, let's have a look at the pectoral girdle. The pectoral girdle or shoulder is made up of the clavicle and scapula. Can you have a look here? The clavicle, there it is there, and that is the scapula. They are very, very unusually, the bones are very, very unusual in shape. Now, what that is designed to do is allow movement of your upper limbs, okay? Now, we're going to look at joints in the next lecture, but what I want you to understand is that the clavicle is actually connected to the sternum, all right, by a joint, but the scapula doesn't have a joint. The only way that it's connected to anything is with muscles. So that's why some people have problems in that area. But we're going to have a look at those later when we look at joints. All right, let's have a look at the arm. All right, we have the humerus, the radius and the ulna. So the radius, the bones of the arm, so the humerus, here we go here, and the radius and the ulna. There are two bones of the forearm and of the upper arm. Then you've got the hand. Oh, sorry.
Sorry, Nat, can you go back to the previous slide? I just want to make a very quick note that usually when we're doing a patient's blood pressure, we do it obviously on the humerus up here. And you can imagine if you do it on the radius and ulna, you could squeeze those two bones together and that can cause obviously injury for the patient. And that's why we use the humerus. It can be really dangerous to put the blood pressure cuff away from there and over the radius and ulna due to the injury it can cause the patient.
That's correct. So if you understand the underlying structures, you can kind of get a bit of an idea of what damage could be done. If there is trauma in that area of the body, absolutely. So we're going to have a look at the hand. So with regards to your knowledge, all the bones that I just want you to understand is that the bones of the hand involve three parts. You've got the wrist, the palm, and then the fingers. Okay, so these are phalanges of the hand, because later on we're going to find that phalanges is also the name used for the bones of the foot. Okay, can you see there you've got 8 wrist bones, then you've got your palm, and then you've got your phalanges. Let's have a look at the pelvic girdle. The pelvic girdle is made up of 2 parts. Now, this part here, this hip bone is actually detached. So this is one part and this is in the second part, and they're kind of assembled together. Yeah, just so you understand, there's 2 parts of the hip bone, and then you've got a joint here that's made out of cartilage. So each hip bone aligns with the sacrum, which is the end part of your vertebral column or your spinal column. The lower limbs, we're going to do that in the tutorial. So make sure you add that information into these lecture notes in the tutorial. Okay, now what I wanted you to understand first before we finish is that, can you see, look, every little bit of the bone has a name. Look, even that little spot here, it has a name. Look, and fancy names too. So just something to be aware of, that for you guys now, I just want you to identify the bone and remember its name, but every little piece has a name. All right, that is the skeleton. Make sure you go to your tutorial.